Welcome back. During the pandemic, many of us put off going to see the doctor, but there are increasing concerns that putting off our health care could lead to higher rates of cancers and other diseases.
So we're calling on our medical expert, Dr. Sheila Wijayasinghe, to let us know what we should be getting checked out right now. Dr. Sheila, welcome back.
Thank you so much.
So, Dr. Sheila, you're a family doctor, so you know better than anyone. Why are people delaying care?
So, during the pandemic, especially the early days, there was so much uncertainty about what COVID was, the effectivity of it, and even worry about, is it safe to actually go into a healthcare setting? So people avoided coming to see us. And then as we opened up, we actually transitioned often to virtual care with a mix of in-person, but I think sometimes our messaging was a bit confusing. Are we actually open? Are we not open? And many people, while virtual care is very helpful in many ways, can't actually access virtual care. So it's not for everyone. They may not have the internet, they may not have a phone or email. And so we were missing people in that way as well. So there's so many different reasons why people were missing care, but we're here, we're open, and I'm really hopeful that we can catch people up because people have really not seen their doctor and we miss you, and we can help you get through and prevent things from happening down the road if we see you now.
What a beautiful message. I love that. And I recently just saw my family doctor after, I bet a year and a half. And we just went through a whole list of things. We did a PAP, we did the physical, and I got a tetanus shot all in one go, and it felt fantastic.
Awesome.
But I mean, just the idea can be overwhelming. So where do you suggest that people get started, or how?
So I'd say the first thing to do after listening to this segment today is to call your doctor's office or email them for that first appointment. Make contact. We are here. And then from there, we start with a virtual visit still, if you can. And then we'd have you review what's going on in your health. Is there anything new in your family history that's changed that might change what I do for you? What's going on not just with your physical health, but with your mental health? And then we can go through a list. Many people are coming in to see me right now who are saying, Dr. Sheila, I have 10 or 15 things that I need to catch up on. We probably won't get to all of those in one visit, but you can book several different visits then we can catch you up. And then from the virtual side, then we actually can decide, do we need to see you in person right now? When can we see you? And what can we do virtually and from a distance than rather you having to come in? So first step, call us, get that appointment booked today, and we'll go from there.
So, Dr. Sheila, we're hearing reports that people are receiving cancer diagnosis at a late stage. So here's actually a scary stat, and I'm going to read this. A U.S. study from the National Cancer Institute predicts there will be more than 10,000 extra deaths from breast and colon cancer due to poor screening during the pandemic. So, I mean, how do we even know if we should be getting those types of screenings right now?
Your family doctor is your foundation of the healthcare system, and a big part of our role is preventative care, and screening is a large piece of that. And so definitely we are missing people right now because of delays in doing screening. And screening is when we test people when they're asymptomatic for common diseases like breast cancer, colorectal cancer, cervical cancer, and skin cancer. So you don't have symptoms, but we're testing the general population because we know with early detection, we can catch it early and then treat and have better outcomes. So specifically when it comes to breast cancer, we start screening at the age of 50, and we do that every 1 to 2 years. So if you haven't had that test done in a while, you can call us or we'll call you and arrange for that. You don't have to necessarily come in to see us to arrange that test. Colon cancer is screened. Also, we can do that virtually. We can either refer you for a colonoscopy, which is done once every 10 years, or it's a test that you can do at home. You collect stool at home that you actually put in a little bottle and put in the mailbox, and then it gets sent in, and that can be also arranged virtually. We haven't figured out how to do PAP tests virtually yet, so cervical cancer screening is done once every 3 years starting at age 25, so that is one test that we need to do. Many clinics are now doing PAP test clinics to catch our patients up in person, so there's designated time for that. And also skin cancer screening is something that we don't talk about enough, but if you have a risk factor for that with family history, you're fair-skinned, and there's other risk factors that may be involved with skin cancer, then that's an important one to come in and see me or see your doctor, and then we can just check out your moles, make sure they're not changing. And those are all screening tests. So if we can catch these things early before you're symptomatic, we can do early detection and treat early.
Dr. Sheila, I want to talk about sexual health because there have been a spike in STIs in certain parts of Canada. I think it's Peterborough and Edmonton have both seen an increase in syphilis. So is this related at all to the pandemic and maybe related to missing appointments?
Yeah, so what we're seeing, especially now, we're noticing it more because as people are coming together more, and also being able to go out and see each other more, then that might result in more interactions, and that results in more STIs as a result. And so, but then they don't know where to get tested. So I always emphasize, even pre-pandemic, any new partners, even with long-term partners, if you're having symptoms, get tested. It's not difficult. For chlamydia and gonorrhea, which is also on the rise, we can do that very easily with a pee in the cup test. So it's very easy to do. I can also order that virtually. You call me, you have a new partner, and then your doctor can say, I'm going to send you a requisition to do that. Blood work can be done very easily for syphilis and HIV as well, and that's really important to get tested. It's underdiagnosed, and this is something, the good news is around most STIs, we can treat them and prevent the spread in the community. And so that's really important as we move forward to start getting tested, but that's again something to call and get seen for. Along the lines of sexual health, birth control is also a really big part of sexual health and reproductive health. And many people are not seeing their doctors because they don't know if we're open or not, but that's an important piece to get checked out as well, because sexual health is all encompassing, not just infections, but the contraceptive piece needs to be dealt with as well. And then really we can do that virtually, except with an occasional blood pressure check for if you're on the pill or something with estrogen.
Of course, everyone's talking about the COVID-19 vaccines lately, but of course, there's a whole slew of other vaccines that we, get. How do we know if we're ready? Jess mentioned the tetanus shot.
Yeah.
How do we know about, what other vaccines that we might need a booster for?
And that sounds like a doozy of a visit, Jess, that you had everything all in. I'm glad that you had everything done. But that's great. Often what we're doing is opportunistically, we're catching people up for their vaccine. So when I'm seeing someone for a PAP, like yourself, I would say, oh, we haven't done a PAP, a tetanus shot, and that's done every 10 years in adulthood. So if you haven't had a tetanus shot in 10 years, it's time to boost that. There's other adult vaccinations that are important to consider as well. Over 65, we vaccinate for pneumonia and for shingles as well. And then flu shots will be coming out in October and November, especially this year. We want to prevent the flu. Last year's flu rates were low because we were in separation. But as we open up, that's also an important one to consider. And childhood vaccinations for kids, lots of delays on that as well happening. And we need to catch kids up, especially as we go back to school. The last thing we need right now is a measles outbreak on top of COVID. And so if we can get everyone vaccinated before school starts or in the next couple of weeks, that would be great as well.
Dr. Sheila, I can't be the only Canadian who has just praised the fact that I could have some calls with my doctor, virtual health and telehealth. Please give us a sense if you think this is something that might continue after the pandemic. Any chance?
Yeah, I'm hopeful that we do. It really depends on how the government sort of funds these sorts of things. But my patients and my colleagues, and myself included, love the virtual care aspect because it allows for flexibility. You don't have to take time off work. You don't have to pay for parking. It can be done really on the fly. Email consults are really easy too. It just has to be known that sometimes you do need to see your doctor. Not everyone can do virtual care, so we remain open for those, especially in those circumstances, who may not have access to virtual care. But it is a really beautiful blended model that I see moving forward that I'm hopeful that we continue.
Dr. Sheila, we always love talking with you. Thank you so much.
Thank you. Call your doctor.